Fires do happen in healthcare premises. During 2008 and 2009, 5 major hospital fires occurred in the London area alone. 4 of the fires resulted in the evacuation of patients, staff and visitors, with 2 requiring the complete evacuation of the hospital or block. Evacuation included children with drips, infusions and non-invasive ventilators, an ICU, and operating theatres in which one patient was undergoing extensive surgery. In a busy and populated area such as a hospital, preventing risks from fire hazards and security breaches is crucial. In healthcare, we are surrounded by flammable materials that may form the basis of fires or aid their spread. But often the pressures of working life and patient care may prevent us from really taking note. For a fire to start, 3 things are required: heat, fuel, and oxygen. These are often represented in the fire triangle. As we are surrounded by oxygen, fire prevention is normally all about ensuring that sources of heat and fuel are kept apart. But in a hospital, things are not quite so simple. In healthcare premises, there are numerous sources of heat and fuel that can cause fires to start if adequate precautions or appropriate care is not taken. An additional complication is caused by the presence of gases like oxygen or nitrous oxide in cylinders and piped systems in the premises. Let's look at some problems that might relate to all healthcare premises, such as the continuous transit of goods in and out. They include bedding, linen, dressings, spirits, gas, and vast amounts of packaging materials which are ideal as fuel for a fire. Generally, these are all perfectly safe unless brought into contact with some form of heat, either deliberately or accidentally. We mention deliberate fires because deliberately started fires are the single most common cause of fire. In healthcare premises, 23% of all serious fires are a result of deliberate fire setting. Look around any healthcare premises and imagine how easy it would be to start a fire. Opportunities may exist from laundry store doors left open, clinical waste bins left unlocked on landings or wards, waste and packaging stored internally or left adjacent to buildings externally. The list is endless, and this problem can only be tackled by staff being vigilant and reducing access to combustible or flammable materials as much as possible. When you return to your work area, look around you and check for flammable materials that could be deliberately or accidentally set alight. Remember, flammable materials can include gases or liquids, such as alcohol-based cleaning gels. And while you are doing this, what sources of heat do you have that might ignite any of those materials? These might be overloaded electrical sockets, faulty electrical equipment, toasters or small cookers, portable heaters. Again, the list could go on. You are often the best person to know what you have in the area where you work that could ignite materials, so the responsibility lies with you to ensure it is safe. What can you do about it? Well, good housekeeping is the key. Locking cupboards, doors and bins, and storing away combustible and flammable materials, as well as oxygen cylinders, in their correct location will all assist in reducing risks. The use of flammable liquids should always be controlled. When they are not being used, flammable liquids should be stored in appropriate storerooms or dedicated storage cupboards well away from any heat sources. Equipment or services which generate heat that may cause ignition should be correctly maintained and regularly tested. Portable electrical equipment should be reported and not used if it is faulty. Remember that any electrical or mechanical item may have the potential to become hot enough to ignite combustible materials if they are placed in close proximity. Due to the rapid patient turnover, items brought in by patients or visitors are very difficult to control. If items look old or are damaged, ask for them to be checked. Remember, even an MP3 player or razor chargers can become hot if placed under pillows. Hair dryers and straighteners can become very hot and should not be placed on bedding, towels, or other combustible material. Candles should never be allowed. Let's be real spoilsports. What about Christmas decorations, get-well cards, stuffed toys, and all the other knickknacks that find their way into healthcare buildings? Are they situated near potential sources of heat? Other risks that you may encounter might be illicit smoking, or contractors either not taking due care or not understanding the fire hazards. For example, when carrying out hot works near oxygen supplies or combustible materials. Remember, highly oxygenated air can add to the potential for a fire to start and spread. So consideration should be given to the isolation of oxygen supplies when an area is being evacuated. Supplies should always be turned off at the bed head when not in use. Maintenance teams should operate a hot work permit scheme for all contractors performing hot works. They should ensure that contractors are familiar with the significant findings of the fire risk assessment, the escape routes, and evacuation procedures. But remember, your knowledge of what risks there are in your work area, especially if you work in a specialist area, is likely to be greater than that of contractors who are often unfamiliar with their surroundings. So, always keep a lookout for potential problems. All staff must ensure waste or stored material outside the buildings are placed in secure bins or compounds. It is recommended that any compound should be in a suitable risk-assessed location or be at least 10 meters from buildings. If a fire does start and evacuation is necessary, remember that clear escape routes and refuges are critical to patient, visitor, and staff survival. Trying to clear these areas of flammable materials, stores, or waste before beds can be moved is not an ideal way to start an evacuation.